Hearing loss is not just a nuisance. It can lead to a serious decline in mental functioning and social isolation. Lisa Bellows, a certified audiologist at Bellows Hearing Institute in Palm Desert, emphasizes early detection of hearing loss to decrease your risk of dementia.
Hearing and brain are connected. The more severe the hearing loss, the steeper the decline in mental function. Patients that have hearing loss are more likely to develop dementia over time.
Lisa Bellows describes the different types of hearing loss.
There are 3 types or categories of hearing loss. There is conductive hearing loss, sensorineural hearing loss, and mixed hearing loss. Conductive hearing loss is in the outer and middle ear areas, such as a swimmer's ear or an infection that happens in the middle ear because of a cold or an allergy. Sensorineural hearing loss is a nerve deafness that can occur from a virus or a trauma or old age or a noise exposure. And then the third one is a mixed hearing loss, which is a combination of the two, such as someone who's older and has presbycusis, aging of the ear, and also has a perforated eardrum.
A certified audiologist will run hearing tests that can help discover a wide range of risks of other health issues.
We can look at an audiogram and get an idea if there are possibilities and comorbidities related to dementia, ototoxicity. We can look at connections between diabetes, cardiovascular disorders. We can also look at an audiogram and determine if there's anything related to kidney function as well. Vertigo, falls, all these aspects of hearing and health are connected.
Lisa Bellows shares a patient's story.
Years ago, I evaluated the son of a patient who was at our office who complained of balance problems and auditory issues. I went ahead and tested this gentleman and was not happy with the diagnostic findings that I saw. I referred him to an ear, nose, and throat physician who did an MRI and diagnosed a very large brain tumor. Thank goodness we went ahead and did this testing for him because he was a commercial pilot. We saved his life and possibly the lives of many other people.
Lisa Bellows outlines what happens when a patient comes into her office.
First thing we do is take a careful case history for the patient. We want to determine what's going on as far as their health issues are concerned, what medications they're taking, what kind of exposures they've had, and what their basic needs are for overall communication. Once we determine how much understanding ability the patient has left at a reasonable level of volume, then we can determine if the patient is truly a good candidate for medical evaluation, medical treatment, surgery, or if hearing aids are in order.
Hearing aids are now high-tech, connected, smart devices.
Hearing aids used to be bulky, large, some of them were attached to eyeglasses. Now we have instruments that are so thin and so sleek that they're hidden underneath the hair, they're hidden inside the ear canal, and can connect to an iPhone or a Samsung product for manipulation, where it is virtually impossible to know that a patient is utilizing a hearing aid.
What should someone do if they think they are having hearing problems?
If you are having difficulty hearing and understanding speech, you can certainly do something about it. Get evaluated, get hearing aids, get back into life, and enjoy your family and your friends.
For an appointment, call Bellows Hearing Institute at 760-340-6494.